Good day and welcome to our channel, Alena Media TV. We are broadcasting from Toronto, Canada. My name is Elsa Abraham. We have some good news, and the good news is Alena Media TV would like to announce to our lovely viewers that we are expanding our programs, so kindly take note of our weekly activities. On Monday, we will report on COVID-19 and editorials. Tuesdays are African history. Wednesday, world news and editorials. Thursday, COVID-19 report and African news. Friday is world history. Saturday is African news and editorials. Another good news is we are starting a satellite broadcast very soon. This satellite broadcast will begin on the 20th of June 2020, which will also be Eritrean Martyrs Memorial Day. Kindly take note of our frequency. Nile Sat Vertical 12728. Symbol rate 27500. FEC 5/6. I repeat, on the frequency is Nile Sat Vertical 12728. Symbol rate 27500. FEC 5/6. We will bring you more details after this short music. For this day, Monday 25th, 2020, we are bringing you COVID-19 pandemic report. Now the news in details. Globally, as there has been 5,267,419 confirmed cases of the coronavirus pandemic, including 341,155 deaths, and 2,315 people have recovered from this infectious disease reported to the World Health Organization. The coronavirus has affected 113 countries and territories around the world. The list of countries and territories and their continental regional classifications is based on the United Nations GEO-scheme. There are three parameters to understand in order to assess the magnitude of the risk posed by this novel coronavirus. Transmission rate, number of newly infected people from a single case. Case fatality rate, percentage of cases that resulted in death, and determine whether a symptomatic transmission is possible. How contagious is the coronavirus? The attack rate of transmissibility, how rapidly the disease spreads of a virus, is indicated by its reproductive number, which represents the average number of people to which a single infected person will transmit the virus. World Health Organization's estimated on January 23rd transmission rate to be between 1.4 and 2.5. Other studies have estimated a transmission rate between 3.6 and 4.0 and between 2.2 to 3.5. Primarily, studies have estimated transmission rate to be between 1.5 and 3.5. An outbreak with a reproductive number of below 1 will gradually disappear. For comparison, the transmission rate for the common flu is 1.3 and for SARS it was 2.0. The novel coronavirus case fatality rate has been estimated at around 2% in the World Health Organization press conference held on January 29, 2020. However, it noted that without knowing how many were infected, it was too early to be able to put a percentage on the mortality rate between a prior estimated had put that number at 3%. Fatality rate had can change as a virus can mutate according to epidemiologists. For comparison, the case fatality rate for SARS was 10% and for MERS 34%. Incubated period, how long it takes for symptoms to appear. Symptoms of COVID-19 may appear in a few as 2 days or as long as 14 days. Estimated ranges vary from 2 days to 10 days, 4 to 2 days, and 10 to 14 days, depending on your immune system, during which the virus is contagious. But some patients do not display any symptoms of the virus at all. According to early estimates by China National Health Commission, about 80% of those who died were over the age of 60 and 75% of them had pre-existing health conditions such as cardiovascular diseases and diabetes. According to the World Health Organization Situation Report number 9, issued on January 21st, the median age of cases detected outside of China is 45 years, ranging from 2 to 74 years. 71% of cases were male. A study of 138 hospitalized patients with NCIP found that the median age was 56 years. 42 to 68 range, and 22 to 92 years. The World Health Organization, in its Mythbusters Facts, addressed the question: does the new coronavirus affect older people, or are younger people also susceptible? By answering that people of all ages can be infected by the virus. Older people and people with pre-existing medical conditions such as asthma, diabetes, and heart diseases appear to be more vulnerable to becoming severely ill with the virus. Citing an example of a patient who died in the Philippines was a 44-year-old male. The patient died in Philippines on February 2nd. In what was the first death occurring outside of China was a 44-year-old Chinese man from Wuhan who was admitted on January 25th after experiencing severe fever, cough, throat before developing severe pneumonia. In the last few days, the patient was stable and showed signs of improvement. However, the condition of the patient deteriorated within his last 24 hours, resulting in his demise, according to the Philippine Department of Health. Serious cases of 30-year-old patients in France. As of January 29, according to French authorities, the conditions of the two earliest Paris cases had worsened and the patients were being treated in intensive care, according to French authorities. The patients, who have been described as a young couple aged 30 and 31 years old, both Chinese citizens from Wuhan, who were asymptomatic when they arrived in Paris in January 2018. Age and sex of the first death, as reported by the China National Health Commission, stated the details of the first 17 deaths up to 24 p.m. on January 22nd, 2020. The deaths included 13 males and 4 females. The median age of the death was 75, ranged from 48 to 89 years. On January 30th, the World Health Organization declared the coronavirus outbreak a global public health emergency, which also refers to a crucial pandemic. Every year, an estimated 290,000 to 650,000 people die in the world due to complications from several influenza viruses. This figure corresponds to 795 to 1,170 sorry 2,781 deaths per day due to seasonal flu. SARS was a coronavirus that originated from Beijing, China, spread to 29 countries, and resulted in 8,096 people infected with 774 death fatality rate. Considering that SARS ended up infecting 5,237 people in mainland China. Wuhan coronavirus surpassed SARS of January 29, 2020, when Chinese officials confirmed 5,974 cases of the novel coronavirus. One day later, on January 30th, 2020, the novel coronavirus cases surpassed even the 8,096 cases worldwide, which were the final SARS accounts in 2003. Globally, as there have been 5,267,419 confirmed cases of the coronavirus pandemic, including 341,155 deaths and 2,315,909 recovered, reported to the World Health Organization. The coronavirus has affected 213 countries and territories around the world and two international conveyances. The list of countries and territories and their continental regional classification is based on the World Health United Nations geoscheme. Let's not forget preventive measures to help stop the spread of the virus. Protect yourself and others around you by knowing the facts and taking appropriate precautions. Follow advice provided by your local public health agency. Clean your hands as often as you can. Use soap under running water and an alcohol-based hand sanitizer to rub in between your hands, your fingers, your palms, and the ring areas. Maintain a safe distance for about 3 to 4 meters from anyone who is coughing or sneezing. Do not touch your eyes, your nose, or your mouth. Cover your nose and mouth with your bent elbow or tissue when you are coughing or sneezing. Stay home if you feel unwell. You can also call all emergency healthcare services in your community to aid you. If you have a fever, cough, and difficulty breathing, seek medical attention, or you can call in an ambulance to help you. And make sure you follow the directions of your local health authority. Avoiding unneeded visits to medical facilities allows healthcare systems to operate more effectively, therefore protecting you and others. Thank you for watching. Like, share, comment, subscribe. Let's know the thoughts on issues happening around you in your community and around the world. Thank you.